I am speaking to you from the traditional homelands of the Gyokano. The Gyokano are members of the Haudenosaunee Confederacy, an alliance of 6 sovereign nations with a historic and contemporary presence on this land. I acknowledge the painful history of Gyokano dispossession and honor the ongoing connection of Gyokano people, past and present, to these lands and waters. My name is Leah Shafer. I'm an associate professor in the Media and Society program at Hobart and William Smith Colleges. My presentation is called The Radical Restorative Justice of the People's CDC. On screen right now, you should see a QR code. Following that code will lead you to bibliographic information, links to the materials I'm discussing, and, if previous experience can be trusted, notes on several critical ideas that struck me moments after I submitted this presentation. I will begin with an introduction. 4 days before the 2022 State of the Union address, the U.S. Centers for Disease Control and Prevention, the CDC, made a change to the risk prevention map of the United States that changed the color of the map from red to green. Before the change, the CDC worked with guidelines that identified a substantially high risk as 50 cases per 100,000 people. After the change, the low-risk category became 200 cases per 100,000, a significant diminution of the original calculations. As the People's CDC, hereafter called the PCDC, notes, the resulting shift from a red map to a green one reflected no real reduction in transmission risk. It was a resort to rhetoric, an effort to craft a success story that would explain away hundreds of thousands of preventable deaths and the continued threat the virus poses. On their website About page, the PCDC links their statement about the map change to a Twitter thread that uses an infographic to illustrate the difference between the two maps and to an editorial that they published in The Guardian in which they say, "We are epidemiologists and physicians, artists and biologists. We're children, parents, and grandparents. We're living with long COVID and losses of loved ones. We've come together with a common anger at our government's disregard for social and public health responsibilities. Though many of us have just met, we inherit hundreds of years of resistance traditions. We greet this work with humility, recognizing that there are still many uncertainties about new variants, long COVID, and the future of therapeutics. Yet we know enough to reject with certainty ineffectual public health policies based on individualistic approaches. And we are certain that there is another way, that collective action has always and can now create a new way forward in responding to COVID and other deadly pathogens." The PCDC is a collaborative of volunteer health experts who craft and offer policy recommendations and guidance around COVID-19 issues. Their work reframes the official U.S. responses to the global health crisis by disseminating critical information across a variety of social media platforms. On their website, PCDC identifies their collaborative project by saying, "Working alongside community organizations, we are building collective power and centering equity as we work together to end the pandemic." In this presentation, I situate the equity-focused work of the PCDC in relation to restorative justice and world-building movements. Using their layered, collective, and equitable social media publications as a guide, I employ recent research on collective action to analyze the ways that the PCDC resists the hegemonic inequities embedded in state-run public health systems and corporate mass media by redeploying and rewriting the rhetorical strategies of those systems. This presentation offers a contextual framing for the PCDC by engaging work from scholars like Ruha Benjamin, Sarah Jackson, Moya Bailey, Brooke Foucault-Wells, and Susan Sontag, scholars whose work in turn draws from and intervenes in critical humanities, communication studies, digital humanities, disability studies, media studies, and public health studies. I will use this contextualizing frame to draw parallels between the PCDC's restorative collective ethos and work on racial counterpublics and liberatory social justice collaboratives. I argue that the PCDC's ethos of care and collaboration employs restorative world-building practices, remediated imagery, and appropriative branding strategies as a response to global crisis. As they say, we must urgently create a new normal in which commitment to community care drives policy and behavior. This charge requires sustained and collective action. I'm going to trace the dimensions of this project's stakes by talking first about the current moment in the pandemic, the way it's being framed by the World Health Organization, and then I will briefly discuss the way that the structure of the US healthcare system exacerbates inequitable access to COVID-19 treatments, support, and prevention assistance. So, what are the stakes of the work being done by the PCDC? As of a week ago, the WHO reported 765,222,932 cumulative official cases of COVID-19 and 6,921,641 official deaths. Though conservative estimates of total global excess deaths during the COVID-19 pandemic suggest that the number of COVID deaths is closer to 20 to 30 million. Globally and in the United States, COVID-19 is an ongoing crisis, particularly for historically exploited populations. Currently, someone is dying of COVID-19 every 3 seconds. The number of people suffering from long COVID is estimated to be 1 in 5 of those who have been infected, and the number of people whose lives have been forever altered by the loss of family and/or community members is essentially incalculable. At the time of this presentation, however, both the WHO and the CDC are de-escalating their COVID-19 programs. In the US, the PCDC was formed in response to the United States' grievously inadequate COVID-19 policies and continues to push back against movements like the decision to end the pandemic state of emergency. I will show you their own reportage on the urgency that led to the forming of their collective in a moment, but first I will provide a gloss on the relationship between modern social movement theory and the status of healthcare in the United States. I focus on the US in part because the healthcare system in the United States is permeated by social movements to a much greater extent than in most other developed nations. Scholars of collective action in US healthcare identify 4 sentinel reasons for the efflorescence of health-related social movements in the US. Gatekeeping among the wide range of professionals and professional specializations in the medical sector, the organization of medical knowledge around disease classification, which links patients to a system of power that objectifies and alienates them from the larger society, the cultural authority of the male-dominated US medical profession, which consolidated economic and political power by transforming women's thoughts and behaviors into sickness of the mind or body, and the corporatization of healthcare coupled with cutbacks in public financing, which aggravated inequalities of race, gender, and class in healthcare. As Verda Taylor and Meyer Zald say in their essay, The Shape of Collective Action in the US Healthcare Sector, the United States is a welfare state laggard. The scourge of American exceptionalism is reflected in the nation's COVID numbers and in the abundance of health-related social movements that grew in response to the nation's bungled and inadequate federal response to the crisis. The PCDC is an example of what Taylor and Zald identify as collective framing, the formation of collective identity in social movements mobilizing to repudiate and challenge medical and scientific understandings of diseases, as well as what Ruha Benjamin calls abolitionist world-making. In this clip, taken from the PCDC introductory webinar, we hear Dr. Mendifulov use the language of collective action and restorative justice as she describes the PCDC's origin story. The hour-and-a-half-long PCDC introductory webinar lays the groundwork of the multimodal deployment of interactive digital tools for creating a public health counterpublic. To summarize what we learned in the moments before this clip, the PCDC began in a listserv discussion about an article on Medium, which grew into an online forum and became a collective, all within about a week in January 2022.
One of the first things we did was collectively write a mission statement, which you can see on our website. I just want to say it's very focused on COVID-19. And so it pretty much says what we think we are and what we think we're doing and what we invite you to join us in doing, which is to provide really sound information that's grounded in a deep analysis of the structural problems in the nation and in the world. And I would like to say I'm just was, somebody who loved and admired Shirley Chisholm, who was the first Black woman elected to Congress. She served 7 terms in Congress. And she was always, her slogan was unbought and unbossed. And that's what we are at the People's CDC. We're unbought and unbossed, and we want to tell the truth and we want to talk about structure.
I chose this clip because it includes Dr. Fullalove's invocation of Shirley Chisholm while foregrounding the intolerable condition of information sharing at the federal level during the pandemic. When and if you get a chance to watch this entire webinar, you will see that the collective voices behind the creation of the PCDC intentionally and strategically align themselves with the US's long history of community and cultural intervention into mainstream political discourse and power. In their book, #Activism, Networks of Race and Gender Justice, Sarah Jackson, Moya Bailey, and Brooke Foucault-Wells identify those working to intervene in mainstream political discourse and power. They contextualize this type of formation by saying groups that have experienced varying degrees of exclusion from political discourse and power have also created notable mainstream interventions through community-centered frames. Some examples here are the newspapers of 1960s feminist movement, which buoyed national activism against the employment discrimination based on gender, and the theatrical storytelling of the AIDS Coalition to Unleash Power, which steered movement among both drug companies and the national government on AIDS research in the late 1980s and 1990s. That national experts in public health and epidemiologists found themselves experiencing varying degrees of exclusion from public discourse about the pandemic in the US further articulates the stakes of this work. Having briefly established the context, history, and ethos of the PCDC's project, I will now turn to a glancing qualitative analysis of their layered, collective, and equitable digital spaces, while acknowledging and leaving for future discussion a consideration of the ways that Instagram posts, Substack subscriptions, and web-based information dumps only reach audiences with access to smartphones, data, and basic media literacy skills. Following the example of the scholars whose work I'm citing, I share my introduction to these interactive platforms and spaces came through personal experience, seeking data, information, and support as an immunocompromised high-risk person married to an immunocompromised high-risk spouse with immunocompromised high-risk parents, an immunocompromised high-risk disabled sibling, and close family COVID deaths. What I found in the PCDC, as well as similar collectives like Your Local Epidemiologists, Those Nerdy Girls, and Project N95, is a network of mutual aids, community supports, and clearly expressed data-driven expertise. The PCDC uses what they identify as a layered and collective approach to information sharing. They do this in response to what scholars of public health Mark Wolfson and Maria Perez in their essay, The Institutionalization of Community Action in Public Health, identify as the challenge confronted by workers in the field of public health. They note that changing community, social, and environmental conditions related to health and illness bear a marked similarity to the challenges faced by social movements that seek structural change. How can individuals be mobilized to support change efforts? What strategies and tactics can be deployed to support structural changes, and how can the attention of the public and potentially sympathetic elites be captured? In this way, the PCDC is following the model that Jackson, Bailey, and Foucault-Wells identify in #activism when they locate efforts towards solidarity and community building in contemporary counterpublics' use of media technologies available to them. As an example of collective world making in the abolitionist spirit, we can read the PCDC's community building practices in their appropriation of the name of the federal agency in charge of the US COVID response, their remixing and remediation of the infographic styles of the CDC and WHO reportage, and their mobilizing utilization of the interactive social media tools which typically represent the US media sphere's neoliberal gig economy. As context for my brief discursive analysis of the PCDC's use of media tech, I offer Ruha Benjamin's gloss on the mutual aid's function as on-ramp for people to get involved in social movements. Benjamin invokes Seattle-based organizer Dean Spade's definition of the ways that mutual aid organizations do three types of movement work. Dismantling harmful systems, which I locate in the PCDC's collective identity and workflow, providing for people's immediate needs, which I locate in their weather reports and weekly updates, and creating alternative structures that can meet those needs based on values of care, democratic participation, and solidarity, which I locate in the PCDC's downloadable What to Do If You Get COVID brochure with an emphasis on its PODMAP illustration. I've gestured toward the PCDC's collective identity throughout this presentation, but as evidence here, I share a few details from the organization's About page, which includes both a map of their collaborative, team-driven workflow and their members, which include public health researchers with arts expertise, poets, community activists, primary care physicians, evolutionary epidemiologists, data scientists, biostatisticians, and more. The PCDC COVID-19 Weather Report is an ongoing post distributed across platforms that acts as a clearinghouse for updated data about transmissions, variants, wastewater monitoring, masking, hospitalizations, and deaths. The Weather Report invokes not just the PCDC's ongoing project of remediating and appropriating mass media messaging in a recontextualizing and rebranding gesture, but also the public health concept of weathering, which was coined in 1992 by Arlene Geronimus to underscore how we embody stressors and oppressors in the broader environment and how this process causes preventable illness and premature death. The Weather Report includes a forecast and links for taking action. This week's report asks folks to join in support of the National Week of Action to keep masks in healthcare, noting that the widespread dropping of universal masking in healthcare is just the latest example of institutions following the politics rather than protecting people using science-based methods. Lastly, I will draw your attention to the website's Resources tab, specifically the resource called What to Do If You Have COVID, and particularly within this, the section of that resource labeled Preparing for Illness. There are many online resources that talk about what to do when you contract COVID-19, but few that I have seen provide such a detailed list, and none frame preparation as an opportunity for community engagement and acknowledgement of communities of care, as the PCDC does when it includes a pod mapping exercise from the Bay Area Transformative Justice Collective. As a preliminary conclusion that reflects the PCDC's discursive strategy of remediation and appropriation of public health infographics, I want to return to the PCDC's pushback to the CDC's map shift in 2022. In her seminal essays on disease, illness as metaphor, and AIDS and its metaphors, Susan Sontag focuses at length on the ways that publics identify, signify, and define illness within quantitative frameworks. As she says in AIDS and its metaphors, in every previous epidemic of an infectious nature, the epidemic is equivalent to the number of tabulated cases. When I regard these maps, just one of the many, many infographics I have struggled to make sense of both quantitatively and emotionally since spring of 2020, I hear echoes of Sontag saying, reality has bifurcated into the real thing and an alternative version of it twice over. There is the event and its image, and there is the event and its projection. But as real events often seem to have no more reality for people than images, and to need the confirmation of their images, so our reaction to events in the present seeks confirmation in a mental outline with appropriate computations of the event in its projected ultimate form. If, as Sontag wrote about AIDS, it is also typical of a modern society that the demand for mobilization be kept very general and the reality of the response fall well short of what seems to be demanded to meet the challenge of the nation endangering menace, then we can see in the layered, collective, and equitable information sharing labor of the PCDC a productive resistance to the typical failures and mobilization of the US response to the ongoing pandemic. I will conclude by offering Ruha Benjamin's reflection on the power of the layered and the collective when she quotes James Baldwin saying, "We are living in a world in which everybody and everything is interdependent." As Benjamin continues, it is not something we must strive to be. We are. Opposing everyday eugenics requires that we acknowledge and foster a deep-rooted interdependence, not as some cheery platitude, but as a guiding ethos for regenerating life on this planet. This is what disability justice organizers have been trying to tell us, and what Indigenous peoples have long asserted, that whether we want to accept it or not, we are connected, not just to other living things, but to those yet born. Our decisions today ripple across time, 7 generations, according to the Haudenosaunee Confederacy's Great Law of Peace. Interdependence is not only part of a sacred philosophy, but also a guiding ethos for refashioning social and political structures. Thanks for watching. I look forward to discussing my work with you.